whenever you're ready.
Okay. Welcome everyone for today's special series, School Mental Health, Navigating the New Normal. Today's session is reopening and planning for the 2021-2022 school year. Our speakers today is David Sullivan, Special Programs Director from Anadarko Public Schools, and Melissa Isaac, Education Director, Saginaw Chippewa Indian Tribe. This project is supported by SAMHSA. The content is developed by the presenter, and the opinions expressed do not necessarily reflect the views of the policies of SAMHSA, HHS, American Indian and Alaska Native, MHTDC. This is our land acknowledgement. Although we are gathered virtually today, we want to take the time to acknowledge the land and pay respect to the Indigenous nations whose homelands were forcibly taken and inhabited. Please take a moment to read this land acknowledgement, which was created by our three members of our team, Ella and Keely Driscoll and Sean Bayer. Next slide. Hi, everyone, and I am your host today. My name is Teresa Brewington, and I am the Program Manager for the National American Indian and Alaska Native Mental Health Technology Transfer Center, K-12 School Supplement. I am an enrolled member of the Kahiri Tribe and the descendant of the Lumbee Tribe. I have a Master's in Business Administration and a Master's in Educational Leadership. I live here in Tama, Iowa on the Meskwaki Settlement with my husband and my granddaughter. We are the National American Indian and Alaska Native MHTDC K-12 Supplement Grant. This program and many others are offered through our center located in Iowa. We're known as the Native Center for Behavioral Health. We serve American Indians and Alaska Natives across the U.S. Here you can find my contact information, as well as our program guide for other services and our technical assistance request form. So if you're wanting any type of individualized training for your area, please just fill out that form and it'll come directly to us. Before we introduce our presenters, we want to open the session up in a good way. So I'm going to ask someone in the audience that will be willing to say a blessing, a prayer, a song, or some words of wisdom for us today.
Hi, Teresa. I can sing a song.
Is that Kevin?
Yes.
Hi, Kevin. How are you today?
I'm doing fine, thank you.
Good. Thank you for volunteering, and I very much appreciate it. So you go right ahead. Thank you.
Okay, I just want to thank everybody for, thank you all for taking your time out for sharing with us your knowledge and your expertise and your what you have to share about school. It's something that we can all use because I have clients who have children and they're all asking about what are we going to do when we get back to school, and the families, you know, they're struggling to get their work all their balance that they had before back into play again. So I learned a lot from a lot of all of your. I just want to thank everybody again for being here. I'm just gonna sing a song. The words in it, there's a phrase there called "Joina Shah." That's a Navajo phrase meaning walk in beauty. And it's just sang in a more of a intertribal style. I don't have my drum with me, so I'll be doing it a cappella here. So, and I just want to thank Creator for all the blessings that we have today. that we continue to move forward and learn what we can to help our communities to heal themselves through these rough times, and to continue to support one another, to persevere, our perseverance, our compassion, our courage, and our love for our Creator, that we continue to show that to one another, support one another in our communities. And this is what the song is all about. That's how we walk in beauty on this earth. Okay. Hey-yo, hey, hey-yo, hey, ho, hey-yo, hey, 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 hey-yo, hey, hey-yo, hey, ho, hey-yo, hey, 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 yo, hey, hey, yo, hey, yo, hey, yo, hey, hey, yo, hey, hey, yo, hey, yo, hey, hey, yo, hey, hey, was your not show? Yo, yo, hey, yo, hey, yo, hey, hey, yo, yo, hey, hey, was on a show, hey, yo, yo, hey, 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 yo, hey, hey, yo, hey, ho, yo, hey, hey yo, hey, hey yo, hey yo, hey yo, hey, hey yo, hey yo, hey yo, hey, hey, was on a show. Hey yo, hey yo, hey yo, hey, hey yo, hey, and hey, was on a show. Hey yo, hey, hey, and oh, thank you. I just want again want to ask for special blessings for all of us here today, all of our families, our loved ones, our children, our elders, and all of those out there that are having a hard time with just their daily activity. That you look upon them, Creator, and give them that strength to just get through this day, and be happy for what they've accomplished today. Again, we love you with all our hearts, and thank you for the blessings of just being awake today and enjoying the beauty that you provide for us. May we always continue to walk in beauty. Ujonaskli, 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 ujonaskli. Aho. Thank you.
Oh, thank you so much for that, Kevin. We appreciate that.
You're welcome.
All right, so do we want to go ahead and pull up the slide deck, Julia? And I'm going to let our presenters today introduce themselves. Melissa, would you like to go first?
I certainly can do that. Bonjour, everybody. Miigwech, Kevin, for that song and that blessing over all of those of us that are present here today. I really appreciate that. So I guess I'll just start. Wabzikwe, meanwhile, Wabshki Wabigwan Dijnakas, Name Dodem, Sagnachipwakin and Donjaba. My name is Melissa Isaac. My Anishinaabe names are Swan Woman and White Flower Woman. I'm Sturgeon Clan, and I'm a citizen of the Saginaw Chippewa Indian Tribe of Michigan. I'm a wife. I'm a mother of 4, and 2 days ago, we welcomed our newest family member. We adopted a daughter, and so that was a really beautiful addition to our family, and just we were overflowing with love when all of that happened. So it's been a good time, good feelings for my family. I am finishing year 1 of my doctorate in educational leadership at K-12. I'm also the director for my tribe's education system, and I oversee a tribally controlled sovereign early I say early childhood immersion school, as well as a K-5 elementary school. We also collect Title VI funds on behalf of 3 of our surrounding districts as a consortium for 750 plus Anishinaabe learners. And so what we're going to talk about today, we have a big stake in the decisions that are made for the sake of our learners. In addition, I was appointed to Governor Gretchen Whitmer's Return to School Advisory Council right at the beginning of the pandemic, and providing what we called the My Return to School Roadmap. And that was really heavily, it was guidance for schools to navigate through the beginning of the pandemic. So it's heavy on safety protocols and public health things. And as we have gone forward and learning what we're learning every day, about COVID-19, was also appointed again to the Student Recovery Advisory Council to come up with the My Blueprint comprehensive student recovery that is focused on social, mental wellness, physical wellness, higher education, and academic achievement of our students. And so that's a little bit about my background and introduction, and I'll hand it over to David.
Kionde Don, David Sullivan Alcon. I just want to say I'm very thankful to join you all here today. Thankful that I have this opportunity to share just a little bit about our experiences here, which are changing daily, and it makes it difficult, but we are working and trying our best to do what's best for our students. That's what gets me up. It helps me to get out of bed every day, is to think about how can I help our young students here in our community. And just to give you a little background on my time here, I've served as the special programs director with the Anadarko Public Schools for the last 21 years. And that project, or that job, has I wear multiple hats with that. Not only am I the administrator for our Title VI GOM programs, I've also take care of our special education program. And we have 2 of the first and only, well, one is the first and then the other is the second, but we have a program for suicide prevention. It's a peer-to-peer mentor program model, the first in Oklahoma. It's called the Hope Squad. And that is comprised of students that serve as the eyes and ears of the counselors within our sites, 3 of our 5 sites that we have here. And then the other, I was able to have a hand in bringing the Communities in Schools grant and project to our district. And that's the second in the state. Tulsa had the first. And so we're glad to have those resources here for our students, because our students definitely need as much help as possible. And what that grant provides is student support coordinators in each of our sites, and they provide multiple opportunities. They provide multiple resources. We try to connect our families with resources. And so far, it's been a great project. And I've also served as served on the Superintendent Joy Hoffmeister's Equity Advisory Council. We've been working on various topics, and it's been an interesting time to work on a council or on a group like that statewide. And so I won't continue on too much longer, but I just again want to say thank you, and also to Kevin for opening us up in a good way. So at this time, I'll turn it back over to Teresa.
Thank you both, Melissa and David. Today's session is extremely important, as we are unfortunately not through this as we thought we would be. So we came together. We have a very good group of consultants and advisors, David and Melissa being two of them. And we came together today or with this project, which is a 4-part series that we felt would be very important for our teachers and administrators that are serving our Native students. So today is one of 4-part series. And David and Melissa is going to be talking about reopening plans for the 2021 year. So you guys can take it away. Thank you so much.
Thank you, Teresa. One of the things as we were, discussing, I have to give some props to David, and we got to know each other a little bit during the planning process and just his experiences and, the way things work and discussing like the similarities and differences in the work we do. But just having in common that stake in our Indigenous learners and, what are our needs and what are their needs and, how do we come together? And it was pretty motivating conversation. So it's been a good experience. The first thing that we talked about was there's a lot of confusion with, well, this district is doing this, but this other district is doing that. The CDC says this, but the state is doing this. And so what we constructed was a flow of information with an emphasis on orders versus recommendations. And so we kind of devised a little flow chart here. And then at the end, we're going to talk about what that looks like for David and the work that he does, and what that looks like for me and the work that I do. And we described what we do in our introduction. So everybody here's the CDC, Center for Disease Control. They're at the federal level. And so you'll hear them recommend things. When there's a recommendation, those things are optional. And so although the CDC, with all of their knowledge and insight into science and public health and things like that, they're I guess it's debatable, credible resource. But if they recommend something, that doesn't mean that your school district or even your state, depending on what's happening, is going to follow those recommendations. So they will put out a recommendation, or in rare occasions, they'll put out an order or a mandate. And so you may have heard recently that the CDC has ordered that anybody who's riding public transportation has to wear a mask. And so that would be what the differences are there. So once that guidance, those orders, those recommendations come out, then we'll go to the left of this chart here. Then the states, because it's not different, it's different across the whole United States, right? Michigan is different than where David's from in Oklahoma. The populations are different than it is in like California, for example. So then each state will look at that guidance. And in my case, it's the Michigan District or Michigan Department of Health and Human Services. They will take that and they will look at what's happening in our state, what's trending. And then they will do the same thing. There'll be orders, there'll be recommendations. It depends on what direction they want to take that. At that point, your local health department, in our case, the Central Michigan District Health Department, will look at the various counties in their area. So we have 4 or 5 counties in our area, and we meet weekly, local school district superintendents, and have discussions with them on the trends they're seeing closer to home. In your county, here's what's happening. And we'll have those conversations. And then at that point, local school districts and the superintendent and the school board will come up with a plan. Now, district to district can look very different as well. Even though our closest district is 5 miles away, their numbers are maybe different than what is happening in our tribal community. So that'll bring me back to the top there with the federal guidance. They're also working with Indian Health Services for tribal and urban Indian health centers. So they're having those conversations, and so then IHS gets into the mix, and then the tribes have those conversations with IHS. That's where I come in, and it's a little bit unique because we are 100% tribally controlled. We follow the guidance of our tribal council because we don't receive funding from the federal government, BIE, or anything like that. So then I have a conversation and I'm watching all of this other stuff happening. I'm listening to what the CDC is saying. I'm listening to what the state is saying. I'm looking at, those meetings with the local health departments, and then looking at what our surrounding districts are doing. And then I'm taking all of that information, and then I'm making a recommendation to my board and to my tribal leadership. We come up with a plan, and then we, in our local health, Nimki Health Department, which is our local clinic here, and we take that to tribal council. And then they say, okay, we see, yes, we support, or hey, we might want to tweak that a little bit. And then whatever we collectively agree on is what our plan is going to be. So there's a lot of different parts that are moving and working here, that really, when you're a parent and you're not privy to how all of this works, it just seems like the school district is making this decision on their own, and doing what they want when that's not necessarily the case. So I just kind of described how that works for me, in making that decision for our early childhood school and our tribal school, but also hearing what's happening in the local districts because of those 750 plus Anishinaabe learners that are attending there, and being able to support families and support the students if they need it with their educational services. And so I will hand it back over to David so he can kind of give you a picture of what it's like from his perspective.
Thank you, Melissa. Our, within our setting, we, primarily it's somewhat different, but at the same time, it's much the same in terms of, within Oklahoma and within our district for sure. Our local school board and our superintendent are the primary person or the primary group that makes the decisions for our school district. Yes, of course, you do have the orders and the recommendations, but ultimately we're structured for local control. And but I will say that that those outside entities do have a pretty good influence, a pretty big influence on our decision making here within the school district. And it can be confusing. And in this time, for sure, as we're going and beginning to start this new school year, it's a little bit more confusing than we had or than we were experiencing this time last year, because the decisions were there were more, more of a mandate being put out from the upper levels, the federal level, the state level. But now that's not happening. Not so much. It is in some places, but it's everyone is, they're trying to look and look at the data and trying to interpret the data and determine if that, if we need to do go into a shutdown, or if we need to do mandates, mask mandates, so we're really in a different setting this year than we were last year. So just as an example, just our superintendent just recently received an email from our local health department that it was basically a forwarded email from a communications officer at the State Department of Education, giving us the notice about the bus mask mandate, that students had to wear a mask on the bus. And this was the first he had heard of that. So it was interesting that it came through a different channel than what we were normally receiving prior to this. So, of course, naturally it caused him to immediately begin making phone calls and emails and trying to determine, is this a legitimate order or is this a legitimate thing? And it made, we, in our meetings, we all debated this, what is that going to do what good will it do if we have everyone riding the bus with a mask, but then there's no mandate for them when they get into the building? So, we're measuring and trying to weigh all of this out, because now we don't have, a clear set path so much. Even though last year it still wasn't so clear and set, this year it's a little bit more open. And so now we're having to really make sure that we're gathering all the data. And it really, to me, it brings the point to the forefront that you really need to make sure you're gathering all the information for your district, for your school, for your region, and making those decisions based on that information, and not just upon a guideline or a recommendation that's made at a upper level. I was talking earlier when we were planning for this, and the CDC, they look at all of this information, this data, but that's at 30,000 feet. And what we're having to do is look at that information on the ground level. And while, the recommendation may be the best for everyone across the board and a blanket approach, and it's based on information that they're receiving, which is changing as well. Oftentimes people think that our government agencies should just know every detail and know all the information, but they're gathering information. Science is a science, but it's a constantly changing thing. It's changing as data comes in, and they realize, well, there's an issue here and there's an issue there, so we need to adjust. And in our climate right now, it's that creates some distrust, and unfortunately that we have a lot of issues with that, but I believe we're going to work through that, and we're all going to have to make the best decisions for our students. That's ultimately what we're doing and we want to do, because we want our students and our families to be healthy in all areas of their life. And so that's what we're looking at in our area. So it's even though this chart that you see, you have it's set up in a circular design, but really if it was a live video or a live feed, you would see a lot of lines crisscrossing across through these boxes, because within our district, we do have we do have 7 tribes that we work with that are nearby. So we are working with our local tribal groups as well, to make sure that we're communicating, that we're sharing resources, and it's something that it's a constant process to keep that relationship, to build it first and then keep it going. But it's just it's a challenging time, but it's also I think it's a good time for us to be able to work with our tribes here in our district. I guess if you could say it, what a silver lining this process, or the issues that have arisen, they've helped our people, all of our groups, to come together and work together a little bit more. And so that's in terms of this area, that I think that would give you kind of an overview of how it works for us. And I'm interested to see if there's anyone now, if you have any other things to add, something different from your area. I would be interested to hear from you. If anyone would like to open it up, we can open it up now. And if anyone would like to share just a little bit, if that's okay with Teresa and the group, just as long as we stay on our schedule as much as possible.
I actually have a question, Melissa and David. I don't exactly understand the rationale behind the whole mask on the bus mandate. And is that just something that they're doing for things to come? What is the rationale behind that?
That is a good question. Like I said, this mandate came from the CDC. So
I know.
So it's not necessarily looking at individual, or I guess I should say direct contact or direct influential data for each of those areas. So, it's coming out as I guess it's coming out as a mandate, but I just don't know how everyone will follow that,
Or
as
how
you
that's
know.
any different from having kids in the classroom
Yeah,
and walking the hallways
that's
without masks being mandated.
right. Well, that's been the focus of our debate since this came out just last week.
Yeah.
Just to determine, okay, what's the reasoning behind this, and why wasn't there a mandate for the whole structure of the school? Why just the buses? So
I have a question.
sure.
Can you clarify what schools are your schools on reservations in Oklahoma? What tribal policies are in place? Do you follow the recommendations from the CDC? I'm here in Los Angeles. We have a lot of a high risk and a high rate of infections. But I'm from the reservation in Arizona, where we also have a high rate of infections, and the Delta variant is now in our community. At least is what our doctors are saying. And when I say our doctors, I'm assuming, I joined this meeting because it talks about Native people, our relationships. What do we talk about when we talk about sovereignty, when we talk about clarity, when we talk about safety within our communities? I'm not getting a clear answer from you, David or Melissa. What is it that you're navigating this new norm? What does that mean with regards to this title of this subject here?
Melissa, do you want to go first, or?
Sure, I can.
Okay.
So we do have additional slides coming back about the new norm aspect of this, but I will answer your question. From my perspective, we are on a reservation. We are operated by the tribe, and we are very aware that we are more vulnerable. And so, for example, last year, we were out of school in online learning for a majority of the year, while other districts were coming back. They base their decisions, the public schools base their decisions on the majority of surveys. Well, we're never going to be the majority on those surveys, being that our percentage of numbers are so much smaller than the rest. But we have that flexibility as a tribal school. And so we were out a lot, and we saw some cases rising, and we were like, okay, what does that mean? Like, what are we going to do? So we started having a discussion, and then that day I got an email from tribal council, and they wanted to meet. I'm like, okay, good. They must have heard about what's happening. So I met with my tribal leaders, and they were worried. And I said, we were going to finish school out for the rest of the week. And then starting next week, we'll go back into an online learning mode. They wanted it more immediate. I said, okay, at least give us till Wednesday so that we can get the kids ready and we can do all of this. And so they were very aware of how that impacts our population, because we all know that it can be detrimental when if there was an outbreak in school, in the community, our family structures and things like that. Oh, the CDC, when they make a recommendation, so they recommended the transportation thing, we're going to follow it. We made that decision to follow it. And our school is small enough where we can cohort our classes. And so while we're cohorting in those classes, the mask will be optional in there, but they will be physically distanced because we have that option. And then when they're in common areas, they will wear masks because we are more vulnerable. So we're being more, the surrounding districts, the masks are optional altogether. And so our decisions are usually a lot more conservative and follow what the guidelines are, making those decisions for our tribal students and our tribal community. So that's kind of how it impacts us. And then, like I said, and we'll answer the new normal part further into the presentation, but does that give you an idea? Does that answer your question? Because if not, I'd like to make sure I answer what you're asking.
No, actually, that was really clear. Thank you, Melissa. I appreciate that. Because I don't want to sit here and make assumptions of, I want us to be clear as Native people. I think it's important for the safety of our communities that sovereignty and longevity are really critical for our communities. Thank you.
Okay. Since it sounds like your question was answered, I won't go ahead and go into any other detail about that, other than just quickly saying that, Oklahoma is a different setting where, we, and this is still being debated now, if you're familiar with the McGirt case, but in certain cases, the reservations in the state were not necessarily done away with by law. So we still have the land and the boundaries in terms of how that was set up back in the last century or two. But as far as how we operate, our local school board is the our sovereign, that's where our sovereignty comes from. But because of the fact that we have a unique situation, because of the fact that we have 75% of our population, and that fluctuates, are comprised of our local tribes. Our tribes have a pretty significant impact and ability to discuss and help set policy within our district. So we do have the tribal consultation process here, and we follow that, and we, not just as a check off box kind of thing where, okay, we had the one meeting a year and now we're done. No, it's a process that we constantly work through to continue and develop those relationships throughout the year. And since we've started that, we've always had the consultation or the process of seeking input, but it's really increased more so in the last few years. So I'll stop there.
All right, Julia, you want to switch to the next slide, please? Oh, she looks like she's kind of glitchy. Anybody else see that? Oh, there she is. Can you switch to the next slide? There we go. So we've kind of mentioned this already, what the CDC guidelines state. And so people are part of the discussion was, well, what does the CDC guidelines, what do they say? And when we put this together, we knew at some point it could probably change before the presentation, or maybe we'll exit this presentation and it'll change again. But for the most part, as David mentioned, it's gone from more of a mandate to just guidance. And so one thing that they emphasize is that children do better when they're in school. But as you mentioned, Shannon, I appreciate you saying, and talking about this, is it also, if you look somewhere else in the CDC guidance, it talks about the vulnerability of Indigenous people and people of color to the virus. And so taking those two things along with all of those other streams of information is really what we're working with when we are part of the discussions about how school is going to look. And then we talked about the mask mandates being an order or a directive from the CDC. I was looking that up when we were asking, or when Teresa asked, what is the rationale behind that? And what I read was that the rationale, according to the CDC, is that people are in close proximity in an enclosed area for longer periods of time when they're on public transportation. And so that could exacerbate or increase the number of positive cases. And so it also sounded like they were looking at updating that. I can't remember the words, I just read it, but they were talking about until it can be updated, here's the guidance, or here is the mandate or directive. So we just wanted to kind of bring up some of those key points that we looked up when we were discussing the CDC guidelines. You have anything to add to that, David, or?
Just that, there are certain precautions that you can do within the buildings that you can't do in the buses, and I understand that. But at the same time, when you look at this in terms of just understanding how schools work, how they operate, how students, yes, you can do you can try to maintain that distance, but it doesn't always happen. And even the mask mandate, we still had issues with students even keeping their masks on, or making sure that they could keep the masks. We had to, we were constantly having to replace the masks, which is that's just part of the process. So it's just it's going to be a challenge either way, all the way around. But at least we have the guidelines, and then from there we can begin to make those local determinations, those decisions to fit within those structures. But at least we have some guidelines for now, and we'll just continue to keep our eyes and ears open as new developments come around.
All right, so one of the other things that we wanted to discuss were cultural considerations specific to Indigenous people. And I wanted to share, or what we're going to share is I think it's like a 2 or 3 minute video clip from our perspective, an Anishinaabe perspective, and kind of have some discussion around that when we're done watching that. But I also want to thank Rachel, because it looks like you and I were both looking up the CDC, their rationale for the mask. So I just saw that and I appreciate that. So if Julia wants to start the clip, we'll go in a cultural direction now.
Yep, give me one moment. If there are any questions at this time too, we can take those, or any additional input after looking at those guidelines.
We can't hear it, Julia.
Is that better?
If you stop sharing and then try to reshare, there's a little box at like a little menu box that'll say to enable the sound or something to that effect.
Yep.
For my people, the sicknesses that are happening today was foretold from the prophecies that were passed down from our old ones. We call them Anwigichigewen, meaning things to come. And so we know from the old prophecies of the past, there is a lot of traditional practices that can help us add volume of knowledge needed for the present times of sickness. For example, it was foretold that people would need to make their own dishes out of wood and never to share them. They were also told of the plant and animal remedies that would be useful during such times. Through the ceremonies and visions of our medicine peoples, it was advised that families needed to self-isolate on the land. When they did this, they would be okay. This all came from prophecy. This all came from ceremony. Our elders always remind us, all of the laws that are being broken right now is what's causing the sickness. Because of this, we have to go back to the old way of life. That's what they always talked about. The elders are constantly reminding us to go back to the land because it's the biggest and most powerful healthcare system we have. The medicines are a part of the answer, and so is being part of the land. We are the land, and the land is ceremony. We're often reminded that hoarding and being greedy is part of what causes the sickness. So if we want the sickness to go away, we have to give. We can't hoard anything. This protects us and takes power away from what feeds the sickness. I believe that we're in a sacred story now, and that 1,000 years from now, they will be telling this story of when the two-legged tried to destroy the earth. I really truly believe that right now, if we follow the natural laws of the land, everything will become beautiful again. Everything will be okay. I remember years ago, my great-great-grandfather said, you know what? We need to go home. We have to go back. And it's okay to do so, because that's where we're going to learn to live again. Now, miigwech. Thank you.
All right, so I just wanted to share that little perspective from one of our Anishinaabe, Nene, one of our Anishinaabe men. Oh, we can still hear. Are you
Sorry.
guys applauding for me?
There you go. Sorry about that.
That's okay. His name is Isaac Murdoch, and he's from Serpent River First Nations in Canada, and shares a lot of stories and teachings and things like that. And so I think there are different parts of that video that you can connect to. He talks about hoarding, and I don't know what was happening or what was running low in your part of the woods when everything first, went down, and just, that's the part that resounded with me when I first, resonated with me when I first watched this. So whatever it is you were supposed to receive from that, take that and ponder that how you will. So switching gears, like I said, to our more cultural considerations, we wanted to talk about family structures and how we have other things to consider. We can voice these things. Luckily for me, I work in a sovereign place where everything, yeah, same here, Teresa, toilet paper was here too, in Michigan when everything first started happening. And interestingly enough, Alfredo sauce, how that's such a necessity. People just needed their Alfredo sauce. But anyway, I have the ability to say, here's the data for us. Here's the trends that we're seeing. Here's what we know about our family structures, because we know what every family of every student that attends our school, and building that relationship with those surrounding districts where they would call and they would say, what are you seeing? What kind of decision are you making? Because we want to take that into consideration when we're making our decision here in the public school, and them doing the best that they can, because they have their other pressures and things that they have to consider but even being asked, historically, that would have never happened. And, David mentioned, bringing people together and making them work together. I've never sat on a public or a health department call ever. Every once in a while I'd send a report, about whatever. But now we're talking weekly and communicating weekly. And so really reframing a lot of what's happening, because we think about COVID and the pandemic and we think about all of these really negative things, but there are also really good things that have come out of it. And one was mentioned in the video, like reconnecting with the land. I know a lot of people are doing that and really looking at traditional, medicines and cedar teas and all of those different things that, people know and have heard about, but are actually practicing now. And so those are the kinds of things that hopefully school districts, public school districts, are taking into consideration when they're discussing the decisions that they're making. And if for some reason you don't have a voice in your system, luckily Mount Pleasant Public Schools, Shepherd Public Schools, and Beale City Public Schools in Michigan, I am there to, contribute that voice. And David is working right in the public school system there. But if you don't have that, go to the public comment things at your school board meetings, send emails and tell them how this is impacting you. Voice your way that way by becoming, civically engaged. And, it might not get you the immediate results that you need, but they can't say that they didn't hear from you. They can't say that, oh, well, we didn't know, nobody contacted us. Because a lot of the times that's what can be said, because we feel like, well, what's the point? I'm going to do this. And I never believed in it until I started participating in the public comment myself. And it's easy to overlook. It's easy to be, we're easily erased and invisible in the first place. But if we make ourselves heard, then they can't say that. Well, we didn't know, they didn't tell us. So that was part of the conversation that we had with family structures. And I know David also brought up some really good points about things that he thought about and was considering. And so I'll hand it over to him.
As we're looking at our process of reopening, we are having very good discussions on, what do we do? We know that we were thinking we were coming out of this, and so we started making plans pretty much like we have done in the past. But we now are realizing that we just cannot do that, and we're having to adjust and making decisions now based on current data. And that's what, one of the things that we talked about, not just what we're getting from the federal level or the local health department level, but we're also looking to gather that feedback from our parents, gather the feedback from our students. And so our discussions are, how does that look? For us, we want to definitely be culturally sensitive and aware. And so we're looking at, what's the best options. And we've been doing this for years, but now it just seems to be so much more relevant or necessary for us to make sure that we're being sensitive to the needs of our families. I'll give you one example that shows me that, we are, some of the work that has been taking place within our program here and our community, our tribes, and working together. We're having opportunities with our tribal programs here that we've never seen before. Within our elementary sites, we're working and developing sensory rooms to where our students can have a place to go if they need a place to decompress, if they need a place to just reconnect just being able to reconnect with their self, with their self-regulation process. But I really appreciate the video that we saw, because it really brought it to my mind that we really need to make sure that we're reconnecting our kids with our local tribes, our local land, and making sure that they have that connection. And that, of course, that's something that I've been pushing that for years, but it just feels like it's a time when we really need to push harder to make sure that our kids have those connections, because it means our survival. And so I'm just, I'm looking forward to making sure that we don't go back to the same thing that we've always done. You know, our districts, our educational system, we've had some adjustment, some growth, some innovation over the years, but it hasn't been a whole lot. And it's always been in pockets. Here you might have a school that has, one principal might have these great ideas and they do some really innovative things, but it doesn't happen everywhere in every district. And so I'm hoping that this will allow us to move our schools on across the board to a new place, because ultimately our kids need it. They need that. They need the new innovative strategies, as well as a connection to our traditions and everything that was spoken about in that video. And so, I'm really hoping that we can move away from the blanket approach and really get down to the individual student level and try to understand what they need and try to meet those needs. And so I'm just looking forward to this coming year. It's been a tough year for everyone. I know in different ways, everyone has had issues. I've had personal issues in my family. My mother was hit hard with COVID. She just finally got to come back home after being in the hospital for nearly 6 months. And so, it's been something of a challenging time, but she's home now and recovering. And so now I feel like I can focus more on helping our students and helping us navigate through all of this now. So I don't know if there's anything else that we discussed, but I'm sure I'll think of it as we continue on with our discussion. But
I was wondering if you both could touch on that third point of the best practice in data collection, what that means. I know, David, you kind of referenced like the blanket approach and how to get around that. Melissa, you were talking about how typically in those needs surveys, Native people are underrepresented. Could you both touch on that?
Sure. For us, what we're doing is, I mentioned it a little bit, but not in too much detail earlier. Through our communities in schools project, our students are, we have, as far as the students that are at the highest need, they're placed on a caseload, and those student resource coordinators are working with them on an individual basis. So that's one way that we collect information from them. And if you're looking at versus, the online options versus in person, what we found is in person works best for our people. Making that connection, really getting connected to them, going to their homes. Not everyone is comfortable as in terms of the educational field. Not everyone is comfortable going out into the homes, and the families aren't comfortable with some of our educational folks coming out to their homes. But with this program, the CIS program, all of our coordinators are from our local tribes, one or the other here. So that has helped to give us that connection, that build that bridge between what's going on in the home and how can we help within the school. There's more to it than that, but I don't want to take a whole lot of time, but I'll just stop there and let you turn it over to Melissa.
Sure, thank you, David. So as far as data collection goes, we know our community, and we know that giving out an electronic survey doesn't always generate the response that we hope for. And so we use a multitude of strategies. It makes things really difficult with the pandemic because we're tribal people. We like to gather, we like to visit, we like to exchange SEMA or tobacco when we're asking people for their knowledge. And, that's been really difficult to be able to do. Or we, see them at the gas station, the tribal gas station, and, we strike a conversation and, we have those kinds of face-to-face interactions, and that has been tougher to do because we also want to be respectful of people in their space when we see them in different places. And so to me, our students in our community, they deserve choices. They deserve to do what they are most comfortable with, and they deserve to tell us what is helping them feel safe and what is helping them feel successful. And so one of the things that kind of worked out, and you would think that there's this tension between come to tribal school, don't go to public school. Our choices were a little bit different, and we gained students because of our more conservative approach, which was based on survey data, calling people, and we opened that up for the community, not just the people that attended our school, because this is the tribe school. This is our community school. And so we opened it up through social media. We interact on social media, which is something that, we didn't typically do before, to hear from people and hear what they wanted, and hear, again, do they want online? Do they want in person, face to face? So, we lost some students, we gained some students because the families had the choice. So there was none of that, you should come here and not go there. It was like, if that's what makes you comfortable and that's what helps you be successful, we will help you make that transition one way or the other. And so that's the approach that we took. We also know that when we did come back face to face, that those mitigation strategies, the masking, the physical distancing, it worked. We had less than, I would say maybe about 5 COVID cases in our school, and 2 of them were online learners. They still let us know, but they were at home and contracted it somewhere else. And the other ones, there was no outbreak from it. And we knew, okay, the strategies work. So you can safely have students face to face if there are those strategies in place that are going to kind of help keep them protected. And so we will follow those strict protocols as much as we can, because we have seen the results for us that they work. And we have found that looking at the data, that some of our students were more successful with the online platform. The majority struggled, but that doesn't mean that the ones who were successful should have that option taken away. And so on a case-by-case basis, we're allowing that to happen because they also feel safer not in the mix, especially with the Delta variant that's kind of making its way through our nation, our states, and our tribes. So just, getting creative, but also making sure that we're making decisions based on the data, the science, the overall stuff, but also in our community and what makes people feel safe and is the best environment for them to learn. Yeah, we can move on to the next slide. Want to kick this one off, David?
Sure. I feel like we had a good discussion on this, in terms of, I touched on it briefly earlier, my hope is that we will utilize this time to provide the options for those students that, rather than the traditional format that we've had before. Like I said, we have pockets of innovation here and there, with whether it's here in this district or any other district. But what I would like to see is that this moving to a new normal would be just a common thing. and that, you know, the process is really geared for the individual student, really looking at the term of student agency, which is essentially making sure that the student is really fully involved in their own learning, not just being a participant in terms of I'm coming to hear from you as the, you know, from the teacher, but really working with the teacher and the instructors, the instructional leaders as a partner within their learning, and they're you know they're working on the process of metacognition to make sure that they're thinking about their thinking, they're learning about how to navigate through situations like what we're doing now. And just content learning doesn't do that. You have to teach we need to teach our students what so many other aspects that they need in terms to, so that they're what I've heard this term called, they're really ready. That's a term of making sure, and there's so many factors with that, and in terms of making sure that they're ready for when the time comes that they graduate and they move into adult life, and just prepping them to make sure that they're not just going to go out and leave, but they're going to stay in our community and help our community flourish and grow into the future. So that's what I'm looking for as we move into this, is to be able to, in whatever way possible, whether it's in policy meetings, all sorts of meetings, making sure that we're making those little steps to get us to that new normal so that our students are able to receive what they need. Let's see.
Melissa, did you want to say anything about that?
Sure. I love the statement that we should not go back to the way that it was before, because we all are very aware that the way that it was before was not working for our learners. I also say that carefully, because one of the things that, one of the terms that I've heard used is lost learning. And I think that's really deficit based, and that we should really be reframing things to be strength based. And that isn't pretending everything's great, but at the same time, learning was not lost. Learning happened. Have you ever seen a first grader manipulate a Zoom room like nobody's business and share YouTube videos and all of these other things? If you would have asked our first graders to do that not 5 years ago, pre-pandemic, feels like 5 years ago, doesn't it? Pre-pandemic, would they have been able to do that? Maybe a couple. But now things have changed as far as, technology and, making videos and, that whole side of it. But also, going back to that cultural aspect, for example, in our family, with my children, we planted a garden because we had no idea if there was going to be a food shortage. Our panic buy was seeds and chicks, little chickens. And okay, we can raise chickens and we can, collect eggs. And my daughters and my sons were there for all of that. We planted an orchard. So we have maple trees, cherry trees, peach trees, things like that. And so they learned. We had ceremony in our home. We didn't travel anywhere for it because we couldn't. We did that here. And so my kids, I shed tears one time because my kids wouldn't have known the songs that they know now if all of this didn't happen. And so will that measure be on a state high stakes assessment? No. But does it make it less valuable? No. In our perspective, that is more valuable. And so when we talk about lost learning, that's a very narrow frame to look at it, because learning did happen and it was valuable. So, just kind of taking that approach and moving forward. And it wasn't like that for every family or every student. Some people had a very difficult time, and I do acknowledge that. But we should definitely take a look at more of a equitable education system, because it wasn't pre-pandemic, and it wasn't for years and years before that. It's not based on the individual student and their needs. It's that majority, right? The majority of the survey says that everybody wants to be face-to-face, no masks. Well, that could be detrimental to us in our tribal communities, but like I mentioned before, we will never be the majority on those surveys. And so when you make these blanket approaches to education, it may be good for the majority, but is it going to be good for us? It hasn't been. And so I think that this is an opportunity to take that narrow scope of academics and broaden it to include their social and emotional selves, their mental selves, all of those, healthy things that, can have a detrimental impact on us. And so that's the conversation when, I'm in these groups that the governor brings together. That's the voice that I'm interjecting into those conversations. Those are the recommendations that we're making on this end. And, having conversations with David, I know that's what he's bringing to the table when he's meeting with the people that he's meeting with. And so it's just, it's an opportunity. If we look at it that way, we just need the Ogichida, the warriors in those spaces to provide that voice for the rest of us. So I appreciate the people who are interacting with their superintendents and who are interacting during public comment and who are interacting with their, powers that be, because again, it's easy to say, well, we didn't know that, we didn't hear from them. But collectively, we can help make this shift, because we all know it's there, just nobody was talking about it before. Now we have to talk about it. And so that's kind of what I wanted to contribute to that part of the conversation.
Mhm.
We have a good amount of time left for some Q&A, and we have one in the chat. Catherine was wondering what people have been hearing about students on IEPs and life skills in the classrooms, kind of a little bit of what we were just talking about, especially if the student is in the years close to leaving school. I don't know if either of you have kind of experienced some of those difficulties in navigating IEPs and students who are close to leaving schools, but any input on those?
I have, a little bit of information. I know what we do here, within our district. Last year was the first time that we utilized the resource. We work with the National Center for Disability Education and Training, and they're based at the University of Oklahoma in their outreach program, the College of Continuing Education. And what we did and what we have now, last year, and we just signed the agreement, the collaborative agreement for this year, is where they have people that work with the students along with our staff that we have here in the district to increase the coordination for, within our parties for those students to help them move to post-secondary education and or competitive integrative employment. And it's based on the student need. It's developed, it goes hand in hand with their IEP, and it works directly for them through that team process, which is what you have in an IEP. Ultimately, I wish we had this process for every student, because that's, but I know in the current setting, the format that we have, it's not quite possible just yet. But at some point, it would be nice to see that where every student has that team around them, and they're really having discussion for them to go through and action and develop something for them, a plan for them that will help them. I don't know if that's enough or if that answered the question, but that's what we're doing here.
Melissa, would you like to add to that?
I was just thinking what the conversation has been around the transition. Most of the conversations that I've been a part of have been, as soon as students get back, we need to create tracks for each of them depending on what their goals are. But it really does, I appreciate that question because it kind of gets me thinking about asking those questions when we have those meetings. So I don't really have any input specific to that, but I'm definitely going to find out because it's an important thing to know. Who asked that? Was it Rachel?
Yeah.
Yeah, miigwech Rachel for that question.
Actually, it was Catherine Palmer, which I know she already knows the answer because she is an IEP specialist herself. So she might
Ooh,
want to chime in as well.
yes, please
Hey,
do.
Catherine. Thank you.
Well, hello, everyone. Can you hear me?
Yes.
Okay. Well, I only know from where I am, and that is Oregon, and I do know that every state has a little different focus. I am really excited to hear the comment that came earlier is the part of looking at the whole person and the whole student, the idea of what are their goals, and the part of continuing education to being part of the community and having employment opportunities. And that's what an IEP is set up to do. And so I just know, talking along the way, I've been on a lot of webinars over the last year, and I did notice that there were some areas that really hadn't thought of some of these ideas in different locations. And so whenever I get an opportunity to bring it up or ask, I want to, because as Teresa knows, I have a son with severe disabilities, and he finished high school in 2009. And at that point, there were limited options in the community. And then as time went on, our state came in with a MOU with voc rehab to schools and to our developmental disabilities program to focus on how to support students to leave high school. And with that, my son was able to get support to get his first employment. And so there are changes going on. Our local area, we have a very active tribal VR that starts at age 18 and goes up, and they have a great relationship with the state VR. We also have community colleges that are looking at how they can fit in. It's a process, and I just, like I mentioned, I am just glad David brought it up, that their state has some new things going on. Melissa, I am very excited to hear you state that on those state meetings, bring this up to see what options there are. I also help with 504s and students with learning disabilities. I am the special education facilitator for our local reservation. And it is something that I feel like I have a true calling. I want to help the students. I want to help the families, advocate for the students. And when time comes, very important for the student to advocate for themselves. Thank you for your time.
Thank you, Catherine.
Thank you.
We only have a few more minutes, so let's make sure that we open this up to the audience to make sure that we have questions. If they have questions, that we answer them. I know that this was very brief, an hour and a half just went by, again, a lot quicker than we expected, which it always seems like we run out of time. So if you guys have questions, now's the time to bring them up. Anything
I have a
specific?
quick question.
Sure, go right ahead, Cheryl.
In the early part of this session, David talked about surveys. And Melissa, I agree with you that children do better in the classroom, especially children that are used to being in the classroom. But I'm wondering how many parents are really eager for their children to go back to the classroom. David, do you have any numbers on that?
I could answer that. There are numbers out there just from last year. I don't know that there's new numbers for this year. I can tell you that one reason why a lot of the schools, at least state schools, are reopening because they sent out a survey at the end of last year asking if the parents wanted them to go back to online learning or in-person learning. And I could tell you in my community, it was 100% in-person learning. However, things have changed. We thought we were at the end of this at that time. And now it looks like we're not, that we may be, that was just a practice run. You know, tomorrow, next week, next month may look a lot different.
Exactly. And with the children being in the most vulnerable position, I was wondering.
And that's why we're having this discussion today, Cheryl. We are in very troubling, questionable, undetermined times. This is like a tornado and we don't know which way it's going. And we have to be prepared. You have to do what's best for your family, first and foremost, and your community, first and foremost. And stay up to date with what Melissa and David was saying with the CDC guidelines. But still, in the meantime, you have to think about yourself and your family.
Yeah, and something that, oh, go ahead, Teresa.
No, go ahead.
Yeah, something that we kind of talked about in planning this session. David had said, I hope you don't mind if I share this, but having a blanket conversation is so difficult because we do live in such different areas. And something that David had said was, you know, if you're not sure, ask. You know, it's great to ask the people that you're serving in your community what their needs are. And I think that was kind of the point of the survey. But it seems so simple, but I think on the mental health side for me, forget sometimes just to ask them what they need and then fill the need that's there.
And I will support what Teresa said. When we first gave our survey, when we were trending in a great direction pre, is it Delta, right? The variant.
Yes.
We had all but one family respond that they wanted in-person full-time with the, you know, mitigation strategies in place. If we surveyed again today, I think there might be more than one family who was considering a different option. And when we send those surveys, we also let them know right now, here's the plan, but also understand that this could change at any time, depending, you know, on what happens here. So yeah, there's definitely the answer last week is different than it is this week. You know, people kind of, you know, change their minds depending on I like that analogy about a tornado and we don't know which way it's going, because that's kind of like, if it goes this way, we'll plan this. If it goes that way, maybe we can do this. If it comes this way, then maybe this is what we're going to do. So yeah, it's definitely a challenging time to make any like concrete decisions, not just for us, but families too, as is evident by the changing feedback on the surveys.
Absolutely. And it's important that we're prepared either way it goes. We have hopefully learned something from last year, I'm hoping. But we are in scary times, guys. We truly are. And especially our Native peoples, which is why we're having this. You know, we were overrepresented with COVID positive cases and deaths last year. We were hit hard in every single Native nation across the US last year. Someone said it's genocide, and it does feel like that in a sense. It's also triggered a lot of postpartum depression in a lot of us Native people. So we have to do what is best for ourselves and our communities. And I do know, and I may be wrong, Melissa, but did you not make decisions for your community before even seeking out advice because you were on the forefront of your community and what their needs were?
Yeah, I was pretty fortunate to be on the governor's panel. There were over 2,000 applicants and I was selected, 25 of us were selected. And so it was a real honor to be able to and I was happy she was made it a priority to hear from, you know, Indigenous perspective. But hearing all of the mental health experts and all of the epidemiologists and, you know, all of those different things, I had an idea of what could happen and what the trend of the virus can be, because that's also really tracked historically. When there's been pandemics, and it could be a slow burn the whole time, or it could be spikes, or it could be waves, you know. And so watching as the patterns started to emerge, I knew that. And so thanks to the knowledge of all of the people, you know, in that advisory group, I was able to have that perspective and into my planning for our tribal community. And so I kind of had an idea of what we were going to do, but I, of course, needed the community's input to guide that decision, because making that decision without them wouldn't have been the right thing to do.
Absolutely. Transparency is the key, being honest and involving your community members. Absolutely. Any other questions, guys? Jill, you want to go ahead and put up the PowerPoint for our next sessions? So Thursday, we're going to be talking about next Thursday, August 12th from 2 to 3:30, self-care and burnout prevention. Melissa and David will be back along with Dr. Mark Baez. And then the next Thursday, do we have that one up or not? If we don't, that's okay. The following.
I just put that one up, but on August 19th, we'll be talking about social emotional learning, which is a huge topic right now. And we will have Melody Redbird Post on to kind of expand our knowledge on that.
Okay. And then we will have the following day Q&A for all of these sessions put together. So if you have any questions regarding any of that, for any of these sessions as we go through them, then that is the time to come on, because we will have all of our panelists on there that day to answer those questions. So Melissa and David is the ones doing this, but we also have other experts coming in to help go along and provide presentations. So anybody want to say any last words? Julie, can you take that down real quick, please? Mm-hmm. Thank you. Kevin, are you still on? Kevin? I was kind of wanting him to do a closing prayer for us. I feel like I need one. You know, we are just in troubling times right now, and I think that video touched me a little bit too, that Melissa and David shared. And I think we need to take that video to heart for our Native peoples, and just take our lessons learned from last year, and let's do better this year. Let's be proactive versus reactive, and do what's best for yourself, your family, and your communities. Would anybody else like to say any closing words, leave us in a good note or anything before we leave today?
This is Twice.
Hi.
Am I on?
You are on Twice. Hi, how are you?
Oh, I'm very well, thank you. I'm calling from Toppenish, Washington. I'm a member of the Yakama Nation, but I'm also Nez Perce and married to the hereditary chief of the Joseph Band of Nez Perce Indians. Follow the Washani Way, which is thousands of years old. It was our way of life. And I would just like to say a few words in our language. to close out the day. I've
Yes.
enjoyed listening to all the interactions and will speak in our language, Klaukush.
Please do.
Ichiiwa, Ayayatwi, Quatlanushamash in Miao, Wakishwat Yao, Kushkit Lauch, Tunanam Kunik, Im Tamanwia, Nashwawia, Kushki Ichna, Tichampa Palaknanim. We're thankful today for all the minds that are come together. We ask Allah to bless each and every member that has spoken today, that the pandemic would not make more suffering to our people. Our people have suffered enough, and we ask Allah to grant strength, continued perseverance. We ask him to continue to bless the education of our people, that we can take care of the younger ones that are still coming, that our knowledge will continue forth through the next thousands of years too. Thankful to each of the presenters. I'm thankful to the people that came up to spend this time to share their education and their wisdom. Ask our Tamanwatla to continue to bless each and every one of you. Klau Kuchnai. Thank you.
Thank you so much for that. That's what I needed. And I hope that helps others on the call.
Thank you.
Yes. I hope you guys got something out of this. And I would love to see you guys next week for our next session. Thank you for being here today. Do we have the Gipper ready, Julia? If anybody wants to fill out a quick survey.
We are not gippering this event.
Not a problem with me. Sounds good. Everybody have a wonderful Thursday. Melissa and David, you know how I feel about you. You guys are wonderful and definitely experts, and I appreciate you coming on today and giving us that information. So thank you, everyone. Have a wonderful Thursday. Be safe. Okay.
Thank you.
Hey, Sarah, you still on?